Hello, gentlemen. If you're over 50, 60 or beyond, and you've noticed that your moments of intimacy feel fundamentally different, specifically if you experience the full sensation of pleasure, that unmistakable moment of climax, but without the expected physical presence of seminal fluid, this message is absolutely critical for you to hear. Maybe it happened just once and instantly triggered a knot of worry deep in your stomach. Or perhaps it's been a recurring silent issue you've been keeping entirely to yourself, feeling a sense of shame or a quiet fear about what it might mean for your health and your future. I'm Dr. William Lee, a urologist with 12 years of specialized experience focusing on men's vital health at every stage of life. And today I want to have a serious but profoundly supportive conversation with you about something that affects far more men than most realize. First, and most importantly, I want you to know that I truly understand your concern. The change you're noticing in your body is not a sign that your masculinity has expired or that your intimate life is over. Think of it this way: it's not a failure. It's a detailed message your body is sending you. And that message simply needs to be decoded. Stay with me, because in the next few minutes we're going to explore the surprising causes, the critical warning signs, and most importantly, the clear, manageable solutions modern medicine offers to restore your peace of mind, your confidence, and your overall well-being. Before we dive into what happens when the fluid is absent, let's take a quick but important look at how this process should work normally. Think of your body's reproductive system as a perfectly timed orchestra. The testicles produce the sperm, the seminal vesicles contribute the bulk of the rich, nourishing fluid, and the prostate adds a protective fluid that completes the mixture. This final cocktail is gathered and prepared in the urethra. When climax hits, specific muscles contract in a powerful rhythmic sequence to propel that fluid mixture forward and out of your body. It's a rapid event, the result of delicate synchronized timing between nerves, glands, and muscles working in perfect concert. Now here's a crucial distinction, gentlemen, and this is absolutely vital to understand. Climax and ejaculation are not the same thing. They are two separate processes governed by different systems in your body. Climax is the neurological sensation of intense pleasure, governed by your brain and nervous system. It's the sensation, the feeling, the experience of that moment. Ejaculation is the physical act of expelling the fluid. It's the mechanical delivery. Most of your life, they happen seamlessly as one unified event, but they are driven by completely separate mechanisms. Our focus today is on what happens when those mechanisms separate. This is called dry ejaculation. This is the technical term for when a man reaches climax, feels that characteristic pleasure completely intact, but notices little to no fluid is released. It's often described to me in my office as an empty orgasm, and I understand why that language creates anxiety. This gap between the expected and the reality fuels worry, and I get it completely. You've always expected a physical sign of the event, a visible confirmation that something has happened, but it's vital to understand that your ability to feel pleasure remains completely intact, governed by your nerves and brain. The change is in the mechanical delivery system, nothing more. This doesn't mean you've lost your vitality. It doesn't mean you've lost your manhood. It simply means one part of your body's plumbing has a specific, identifiable reason for the change, and identified problems are solvable problems. Quick pause before we explore the main causes. If you find this information helpful, please hit that like button to tell YouTube this video matters. Subscribe to join our growing community, and drop a comment below. Tell me where in the world you are watching from. I love seeing this brotherhood of men supporting each other across continents. Now, let's break down the 3 most common causes of dry ejaculation. Knowing the why is the first step to feeling in control and reclaiming your confidence. The first cause is what I call the gatekeeper. Is too relaxed. This is retrograde ejaculation. The single most common cause of dry ejaculation is called retrograde ejaculation. The biology is straightforward. Picture a small muscular valve, a gatekeeper at the exit of your bladder. During climax, this valve should clamp down tightly, forcefully, ensuring the seminal fluid only has one way to go, forward and out. If this valve is too relaxed, the fluid following the path of least resistance flows backward into the bladder, instead of outward. You feel the full pleasure of climax. The sensation is completely normal, but since the fluid doesn't exit your body, it appears dry. It feels dry. The practical clue, a common and non-alarming clue, is noticing your urine is cloudier right after intimacy, as the fluid is now mixing with it. That's a telltale sign of retrograde ejaculation. The practical cause of this condition is often straightforward. This frequently happens after certain surgeries on the prostate or bladder. The procedures are successful and absolutely necessary, but they can affect the delicate nerves controlling this gatekeeper valve. It's also a known side effect of specific medications used to treat conditions like high blood pressure or an enlarged prostate. The medicine works on the blood vessels, but it also relaxes that tiny muscle in unintended ways. I remember a patient, a very proud man, who was deeply distraught after a successful prostate surgery when he discovered the change, when he understood it was purely a mechanical alteration like a traffic light being stuck open, and that his desire and his ability to feel pleasure were completely unaffected. He felt immense relief. That's the clarity you need to understand. The second cause is the plumbing is blocked. This is called duct obstruction. Our second major cause of dry ejaculation is an obstruction of the duct through which the seminal fluid passes. The biology is this: the seminal vesicles and other glands are producing the fluid normally, functioning as they should, but think of the small ducts as delivery pipes carrying the product to its destination. If these pipes are blocked, the delivery vehicle can't pass. The volume drastically decreases or disappears entirely, even though production is fine. The system is working, but the output is blocked. The practical causes for these blockages can include the scarring left behind by past infections, such as a severe untreated prostatitis. Rarely, small calcifications, like tiny stones, can form and block the passage. The practical signs and symptoms can be subtle, but some men report a new mild discomfort in the pelvis during climax. They may have noticed that the fluid has become progressively thicker and less abundant over a long period of time, a gradual decline they've been accepting as normal. The excellent news is that many of these obstructions can be cleared. Often medication to manage inflammation can restore flow. If needed, minimally invasive procedures can restore normal function completely. The third cause is the fuel is low. This is about hormonal factors. The third major area to investigate is hormonal factors, specifically low testosterone. The biology is fundamental. Testosterone is the primary fuel for the male reproductive system. It doesn't just regulate desire and sperm production. It is absolutely crucial for the optimal function of the prostate and seminal vesicles, which contribute the bulk of the fluid your body produces. When testosterone levels drop significantly, the entire system slows down. Production decreases, delivery weakens, the whole process becomes less robust. The emotional impact can be profound. Initially, you might notice a reduction in fluid volume, but over time this deficiency can show up as decreased libido, less firm erections, and a generally less intense sensation of climax. On a broader level, men often experience fatigue, mood changes, and loss of muscle mass. The decline feels comprehensive. The practical solution to this is that this is often a condition called hypogonadism, a treatable hormonal deficiency. If a simple blood test confirms a deficiency, carefully managed hormone replacement therapy can often restore not only better fluid production, but also energy, desire, and overall quality of life. It's a critical mistake to just chalk this up to getting old, to accept it as inevitable aging. While most of the time these causes are manageable and fixable, as your doctor, I must also address the critical exceptions that demand your immediate attention. Dry ejaculation can sometimes be a red flag for a more serious condition, which is why paying attention to accompanying symptoms is absolutely crucial for your health. When to see me immediately? If dry ejaculation appears suddenly and without any explanation, especially if it's accompanied by pain, blood in the urine or fluid, fever, or a loss of sensation in the genital area, do not wait, do not delay. These are signals that require an urgent urological evaluation. Conditions like certain neurological diseases, like Parkinson's, or uncontrolled long-standing diabetes, or in rare cases specific urological cancers, can interfere with the plumbing or the nerve signals that control the entire system. These are serious conditions that need professional assessment. The emotional impact of all of this is real and profound. Beyond the physical mechanics, we cannot ignore the psychological weight this takes on men. Many men, if not most, equate the presence of fluid with their performance and their vitality. When it disappears, feelings of inadequacy, anxiety and frustration can take deep root in your mind. It's common for men to start avoiding intimacy out of fear of being judged or feeling incomplete or ashamed. The emotional reassurance I want to give you is this: the most important step to breaking this cycle is information and communication. Understanding that this is a physiological change, not a personal failure, lifts an enormous weight from your shoulders. Your ability to feel pleasure, have erections, and enjoy connection does not solely depend on the presence of fluid. Your intimate life can and should remain a source of joy and connection. To wrap up, I want to leave you with a clear, supportive action plan to take back control of your health and your confidence. First, don't ignore it, investigate it. A sudden or progressive onset of dry ejaculation warrants a visit to a urologist who understands these issues. A simple history, a physical exam, and often a blood or urine test are all that's needed for a clear diagnosis. You deserve answers. Second, control the underlying conditions. Keep chronic conditions like diabetes, high blood pressure, and cholesterol in check. These directly impact the vascular and nerve health that controls the whole process. Third, break the silence. Talk openly with your partner and your doctor. Talking about what you're feeling is liberating and paves the way for real solutions. Professional support, whether it's a medication adjustment or a specific treatment, is your best tool for restoring confidence. In summary, gentlemen, the absence of ejaculation isn't the end of your intimate life or a verdict on lost masculinity. It is a signal from your body that deserves to be heard and investigated with the help of a professional. Understanding the cause, whether it's mechanical, obstructive, or hormonal, is the first step to finding peace of mind and reclaiming your confidence. I've seen countless men regain their confidence, their vitality, and their joy in living after receiving a clear diagnosis and action plan. Their lives transformed once they understood what was happening and knew they had options. Your vitality isn't measured in milliliters of fluid. It's measured in your health, your well-being, and your ability to live fully and connect deeply with the people you love. Don't let doubt or shame stop you from seeking answers. Acting in time can completely transform your experience, restoring the security and intimate connection you deserve. If you found value in this message, please share it with a friend, father, or brother. This information can truly change someone's perspective and save them years of unnecessary worry. Leave a like to help this message reach more men who need to hear it, and subscribe to the channel, turning on notifications so you don't miss our upcoming content on men's vital health. Remember, your best years can still be ahead of you. Be proactive, be confident, and stay blessed. I'm Dr. William Lai, and I'll see you in the next one.